Hey everyone, today we're talking about two key heart failure medications, dopamine and dobutamine. I'll explain why we use them, how they work, and their side effects. Let's jump right in. Why are these drugs used? Dopamine and dobutamine are inotropic agents, increasing the heart's ability to pump blood. They manage acute heart failure with low cardiac output or poor perfusion, used in emergencies to stabilize patients quickly. Now, let's get into how they work. Dopamine has a dose-dependent mechanism of action. At low doses, it acts on dopaminergic receptors, increasing kidney blood flow. At intermediate doses, it stimulates beta-1 receptors, increasing heart rate and contractility. At high doses, it activates alpha receptors, causing vasoconstriction and raising blood pressure. This is why dopamine is used in heart failure with hypertension. Dobutamine primarily targets beta-1 receptors in the heart. It enhances heart contractility and increases cardiac output. It has a mild effect on beta-2 receptors, causing slight vasodilation. This makes it great for acute heart failure with low cardiac output. Dobutamine is preferred for acute heart failure patients because it improves the heart's pumping ability without significant vasoconstriction. Dopamine is used when the patient has severe hypertension and needs increased cardiac output and blood pressure support. Let's talk about dosage and administration. Dopamine and dobutamine are given as continuous intravenous infusions. Dobutamine starts at 2 to 20 micrograms per kilogram per minute. The dose is adjusted to increase cardiac output without excessive tachycardia. Dopamine starts at 1 to 5 micrograms per kilogram per minute. For blood pressure support, increase to 10 micrograms or higher. Monitor for side effects as the dose increases. These medications are used short-term, generally for a few hours to several days, depending on patient stabilization. Long-term use is avoided due to risks like arrhythmias. Their role is to provide temporary hemodynamic support, while other heart failure treatments are optimized. Both drugs come with potential side effects. Dobutamine can lead to tachycardia and arrhythmias. It may also cause hypertension. Dopamine has dose-dependent side effects. At higher doses, it can cause hypertension and tissue ischemia. It can also trigger arrhythmias and tachycardia. Both medications may cause nausea, headache, and tremors. So, can dopamine and dobutamine be used together? Rarely, but it can happen. In cardiogenic shock with severe hypertension and low cardiac output, they might be combined. Dopamine supports blood pressure. Dobutamine enhances cardiac contractility. This is not typical due to increased risk of arrhythmias. To wrap it up, dobutamine is preferred for improving cardiac output in acute heart failure, while dopamine supports blood pressure in hypertension. Both are short-term infusions requiring close monitoring. I hope this clears up their use in heart failure. Give a thumbs up and subscribe for more insights. See you in the next one.